Hi everyone, welcome back to Elephant in the Room, a platform that we are using to untaboo infertility conversations. Thank you to everyone who liked, shared, subscribed, and commented on our previous videos. And to everyone who has not, we are going to leave a link for you in the description box. Please go back and watch our introduction to Rainbow Hearts Foundation and also what Rainbow Hearts really means to us. In today's video, we are going to talk about some of the causes of infertility in women. We'll start by describing infertility. Infertility is described as the failure of a couple to conceive after 12 months of having regular unprotected intercourse. Guys, it has to be regular and it has to be unprotected. So you should not be on any form of contraception. And also regular means 2 to 3 times a week. So don't be there trying once a month, once in 2 months, and you think that you're trying. No, that's not trying. Guys, trying is 2 to 3 times a week. So if you've done that 2 to 3 times a week for 12 months, which is a year, then there is need to actually seek medical help. Now, infertility is further classified, is classified into primary and secondary infertility. Primary infertility is where a lady has not been able to conceive at all in the past, but also has not carried any pregnancy to full term. And then secondary infertility is where a lady has been able to conceive in the past, has had a live birth, but is now having issues conceiving. Now, when I talk about carrying a pregnancy to full term, it means being able to, there are no miscarriages at all, because we have seen people who actually have miscarriages all the time. So these miscarriages are a symptom of, or are an indication of, infertility. Now, we further break it down into causes of infertility which are detectable at birth, then causes of infertility which present later in life, but also causes of infertility which are preventable. So these preventable causes really can be because of our lifestyle or things that we have exposed ourselves to that have now caused us challenges conceiving. We are going to start with the causes which are detectable at birth. So some of these causes detectable at birth are congenital anomalies of the uterus and congenital anomalies with the cervix. Now, when I was at the hospital, not as a doctor but as a patient, I was exposed to stories of some women who are born without a uterus. And we all know that the uterus is where the baby grows. This is the housing, this is the shelter, this is the lodge of the baby for 9 months. So if this lodge is absent, then the baby is not, there's nowhere for the baby to grow. So this person by default falls in the category of infertility because they cannot be able to carry a pregnancy. And then there are people who have issues with the cervix, whether the cervix is too small, whether the cervix was not fully formed, and in most cases anomalies with the cervix extend into anomalies with the vagina. But we'll have doctors to come on here and just explain deeper about some of these anomalies and if they can be prevented and what are some of the causes. When we look at some of the causes that present themselves later in life, we have things like fibroids. So fibroids are non-cancerous growths that grow inside the uterus. Sometimes they are big, sometimes they are small. And so for different people, the fibroids are presented in different places. Some their fibroids block their fallopian tubes, which also causes extra issues. Some people have fibroids so small that they don't have any issues. This person will even never know that they have fibroids because they're able to conceive normally. They carry their pregnancy to full term without any disturbance. They give birth properly, and you will never know if this person actually has like a normal birth. Maybe the scans were not able to even detect that there were any fibroids. This person will never know that they have fibroids. Then some people have fibroids as big as babies. This person will look pregnant, but they'll actually be carrying a fibroid inside of them. And then there are some people who have fibroids which are located in the, let me say, like if an embryo were to implant, it implants where a fibroid is located, so you end up miscarrying. So fibroids are actually a very big cause of miscarriages in some people. And also we've seen some people have operations from fibroids, and then if it has not been done by a professional, you end up having scar tissue, which scar tissue is also going to cause you issues conceiving. Why? Because maybe every time you conceive, you miscarry. Then we have things like cysts. So cysts are small fluid-filled sacs, and these cysts can be anywhere in the body, but today we are going to talk about, in particular, ovarian cysts. So ovarian cysts can also be caused by two conditions. One is endometriosis, and another one is PCOS. PCOS is polycystic ovarian syndrome. Today I'm going to talk a bit about PCOS and endometriosis, but these two causes are really wide. They have a lot of information about them, a lot of things that we need to learn about them. So I will cover endometriosis and PCOS in their own videos in depth, but today I'm just going to give a brief about them as causes of infertility. So PCOS is really caused by an imbalance in a reproductive hormone. So when a woman has a hormonal imbalance, it could cause them polycystic ovarian syndrome, and there are different symptoms of PCOS. So some of the symptoms of PCOS are a woman who has like a male patterned hair distribution. So you're going to find some women with hairy hands, hairy legs, beards. Some people even have like a mustache. All these are hormonal. This is a hormonal imbalance. Then there are some people who have acne. There are some people who have skin tags. There are some people who have basically you have like a male-shaped body. Then another symptom could be irregular periods. All these are symptoms of PCOS. But maybe one thing that I should point out is that not everyone who has polycystic ovarian syndrome has problems conceiving. So there are some people who have a hormonal imbalance, but they will never know. They have PCOS, but they will never know. Why? Because they conceive normally without any problems. They carry their pregnancies to term and they have like 10 children. So this person has PCOS, but it's in small doses. So this person will never know because there's no symptom at all. Then there are some people who have PCOS and the symptoms are so much, or the symptoms are so, they're exaggerated that they actually cause you problems. They interfere with your reproductive system, or they interfere with your ovaries. Now, we're also going to talk about endometriosis a bit. So endometriosis is where tissue, which should be inside the uterus, inside the womb, presents itself outside the womb. It could present itself on the fallopian tubes. For some people, it goes into their intestines. For some people, it goes onto their ovaries. So what the problem is that everywhere this tissue has gone, which is outside the uterus, when you're in your period, or when a woman is in her period and she's bleeding, when those cells of inside the uterus bleed out, everywhere those cells have gone will bleed. Where the challenge is that they do not have an exit. So you see, inside the uterus, when that line sheds, it flows out through the cervix, through the vagina, and you're having a period. Now, everywhere the other cells have presented, whether it's on your ovaries, whether it's in the intestines, whether it's on your fallopian tubes, they will bleed, but they do not have an exit. And there is a lady that I heard of who actually had these cells go to as far as her liver. Was it her lungs? It was her lungs actually. The cells went to as far as her lungs. And every time she was in her period, her lungs were bleeding as well. Now, most people with endometriosis have severe cramps during their period. Severe cramps. We've seen people who literally fall sick. Like this person is vomiting, this person is on bed rest because they are in their period. Sometimes these people have endometriosis, and it's because of these cells that have gone where they should not be, and when they are bleeding, there is no exit for that blood. It causes you issues. When this blood even clots, it's going to cause the person's organs to attach. So you'll find someone's someone's intestines are attached to their bladder, are attached to their uterus. Like the organs inside there are attached. But why? Because of this blood that was just there and it had no exit. Then now also because everywhere these cells are and they bleed, that is a wound. So when the bleeding stops, the wound seals up, causes a scar. The next month, the same thing happened. Wound bleeds, seals up, causes a scar. So basically, for several years, this person is having wounds that bleed, seal up. Wounds that bleed, seal up every month. These wounds are going to cause scars. That is why sometimes people with endometriosis have damage to their fallopian tubes. If the endometriosis has presented outside your fallopian tubes, it could cause them to deform or to block, causing you issues with fertility. If they present themselves on your ovaries, they could cause you ovarian cysts also, which is also a cause to infertility. Now, the other thing also, just as in PCOS, not everyone who has endometriosis suffers from infertility. There are some people with endometriosis, yes, maybe sometimes they even have pain during their period, but their conception is okay. They get pregnant normally, they give birth normally. Then there are some people who are going to have endometriosis and it causes them or exposes them to infertility. So just as we said, we are going to have this discussion further and in depth about endometriosis and about PCOS so that people properly understand what these two diseases are or what these two conditions are in depth. Now, if you have a story to share with us, if you have any condition of infertility, any cause of infertility that you have suffered from, that you are going through and you'd like to share with us, please leave it in the comment section. If there's anything that you'd like us to discuss, causes that we've not talked about here, I know there are very many. Please share all those in the comment section. Let us know what your experience is. Let us know what some of the causes or symptoms you have experienced. And let us stop shaming people because of what they are going through, because people are actually going through pain. These are wounds, these are unseen wounds that people are going through, but they did not bring onto themselves. I mean, these are things that presented later in their life, not because of something that they did, but because the body just happened to be that way. Don't forget to like, to share, to subscribe to our channel. And until next time, bye-bye.